Hello everyone. Welcome to the scenario 10 and the final chapter of this series, brought to you by the Medicine Project. Let's take a look at this unique case. So, a 38-year-old male, chronic alcoholic, was brought to the emergency with complaints of recurrent vomiting, confusion, and aggression. Patient was apparently binge drinking since 2 to 3 days. The vomit initially contained food particles, and in the later episodes, it was mixed with blood and bile. On examination, BP was 90 by 70, pulse was 122, chest auscultation revealed bilateral coarse early inspiratory and expiratory crackles. Patient was confused and disoriented to time and place. There was diffuse abdominal tenderness, and it was severe in the epigastric region. A bedside ABG revealed the following findings. So pH is 7.4, PaCO2 is 20, bicarbonate is 12, sodium 140, potassium 3.6, and chloride is 90. Now describe this ABC disorder and also analyze the anion gap in this case. Right. So this patient is a case of high anion gap metabolic acidosis with metabolic and respiratory alkalosis. Now let's review the formulae that we have discussed so far to get to this diagnosis. First is the Winters formula. Based on this, the PaCO2 should have been between 24 to 28 millimeters of mercury, which is clearly not the case. And PaCO2 is much lower, indicating an underlying respiratory alkalosis. Now, the anion gap formula reveals the value here of the anion gap to be around 38. This is quite high, indicating that this is a high anion gap process. And since bicarbonate is low, it is safe to say that this is a high anion gap metabolic acidosis. Now the delta anion gap in this case equals 26 and the delta bicarbonate is equaling 12 based on the formula. Now the delta gap, that is the difference between these two values, is seen. It is significant, meaning that the bicarbonate did not fall as much as it should have. Basically, for the anion gap to be this high, the bicarbonate should have been too low, which is not the case. So this means that something is pumping bicarbonate into the blood to maintain its value, and logically this process can be termed as metabolic alkalosis. So summarizing the above three processes will give us the diagnosis. Now let's summarize the whole thing. So in this slide, I have incorporated a cheat sheet for all the ABC disorders that can be asked. Further, I have also included the formula for corrected anion gap based on the albumin levels and is important in critically ill patients. So this is a table to identify the primary driver. You can take a screenshot if you want. And this is the delta gap table. And if you see the second row, you'll get the diagnosis in this question. Thank you. Please like and follow.